Welcome to Issues and Answers with Diane Kinderwater. Issues and Answers is presented as a public service to inform, educate, and better the lives of New Mexicans. And now, Issues and Answers with your host, Diane Kinderwater.
Welcome to the program. I'm Diane Kinderwater. Call 911. Yes, I'm saying call 911. We have a medical emergency in the state of New Mexico. What's the emergency? Oh, I think you know and I know. We don't have enough doctors, nurses, anesthesiologists, physical therapists, you name it. What medical professional do we have a lot of? I'm not sure if we have any. We have a need for medical professionals because our population is aging and, of course, we are poor. Well, there's also a lot of red tape and bureaucracy, and of course, we can't forget those lawsuits. All of those things are driving medical professionals away from our borders. But there is a nonprofit that is coming to the rescue, actually has come to the rescue since 1981. It's New Mexico Health Resources. On the program today, we're going to talk about New Mexico Health Resources and the big job they're filling in the state. They're finding, placing, and hopefully retaining medical professionals here. It's kind of like a clearinghouse to find them and keep them. And they also have the job of telling the state where medical professionals are needed, especially in rural areas, which of course we know are underserved. Well, to make it simple, very simple. Now my guests say it's not simple. I say it's simple. Tell the state we need medical professionals everywhere and we need them now. We're going to discuss how New Mexico Health Resources is doing that job, finding doctors, nurses, anesthesiologists, and more, and hopefully retaining them. We'll be back right after this. Welcome back to the program. I said at the intro, it's simple. Oh, you're going to find out how complicated it is. It's just not finding and retaining them. Also, they have to match the state requirements. They have to make sure that they have, the correct licensure in the state. So it isn't simple at all. We're just joking because we want to have something to laugh about. But keeping them and retaining them is important, and that's where New Mexico Health Resources comes in. It's like a one-stop shop, and they are coming to the rescue. And these are the folks for 30 years who have been working with New Mexico Health Resources. Welcome to the program. Jerry Harrison is the executive director, and Melissa Candelaria is the director of operations. 30 years. Fantastic. Okay, Jerry, starting with a simple question. What is the state of health in New Mexico?
There is just tremendous demand for every health professional that we can find or that anyone else can find. One of the things that Melissa does is to identify what organizations are looking for in terms of health professionals.
Great demand, Melissa. What do you do?
The main, as you can tell, Director of Operations, there are many roles. I feel like my most vital role at New Mexico Health Resources is in relationships. I create and maintain relationships with as many organizations throughout the state as I can.
What kind of organizations?
We work with nonprofit organizations, your community health centers, your rural health clinics, your hospitals, even the larger hospitals, the critical access hospital. Anybody that wants to work with us, private practice, we are willing to work with them.
And what are they screaming out? What are they saying?
We need doctors, we need health professionals.
Because what are their patients telling them, Melissa?
What are their patients telling them?
They need
I can't get in.
They can't get in.
I can't get in.
I can't get in. And that's what they always say, when you're calling up your physician or whoever your medical professional. Now they're always saying, if there's a medical emergency, dial 911. It's like, because we can't get in.
One of the interesting things that has changed is that we have health professionals contact us and ask, where can I find a primary care physician? Where can I find this? Where can I find that?
People who, poor Melissa, she's developed all these relationships, so they think you're going to, even the professionals cannot find a primary care physician, and they think you have the magic wand because you've helped them find them. Now they want them. Oh, that's amazing. How long has that been happening, Jerry?
It started happening about 10 years ago. And we raised our voices at that time that there was really a need to start addressing what we saw as a demographic change, in the sense that people were leaving because of age, and we didn't have ready replacements to come in and take their places.
Oh, you're saying the medical professionals were leaving because of age.
Correct.
Well, I was thinking maybe, Melissa, residents are communities leaving because you hear that. You hear, I can't get a doctor. I'm going to go to Phoenix where I can find a doctor. I mean, have you heard that our population is moving when they age? Well, you hear that. Well, if you read those, the senior living magazines, where the best place to find a doctor, I imagine they're going to start going to those communities and not New Mexico.
Well, I think that there's a different fabric when you get into rural New Mexico in particular, because you have different kinds of delivery systems. And so, for example, we work with the critical access hospitals, we work with the community health centers, of which there are a couple hundred scattered throughout the state. And they tend to have a variety of particularly outpatient health professionals. And it's when you start getting into the loss of physicians, when you lose a physician, you're going to lose the other health professionals as well. Physician assistants, nurse practitioners have independent practice, but once you start losing your physician, the answer is people either start going to Denver, Dallas, Phoenix, or they make long treks into Albuquerque.
The rural folks.
The rural folks.
Or what have you seen change? Thank you for that, Jerry. Melissa, again, getting back to what you're doing, what have you seen? I mean, we started this in 1981, 30 years you've been in it. I'll do the rough math, 1992, 93, right? So, or is that 95?
94.
94, yeah. What have you seen? I mean, we started this because there was a need 30 years ago. And now we're even older. We're even older. So what's going on? What have you seen?
I feel like 30 years ago when I was first brought on as a nurse recruiter, that was the big deal then. We needed an individual nurse recruiter in our facility. Now I'm more of a, not just physician recruiter, it's kind of more broad. It's all health professionals now. So there's kind of a cycle at sometimes. I think back then it was nurse recruitment there was a shortage of nurses. We still are in a shortage of nurses, but I feel like sometimes it's kind of a cycle.
What about rural New Mexico back then? Was there, I imagine these physicians who have left at age 80 were 50 years old and they were practicing 30 years ago. So was there that great need to find physicians in rural New Mexico back then?
Absolutely.
There still was back then.
Mm-hmm. I grew up in a rural area in southeastern New Mexico, and I don't recall ever having to travel less than an hour to even go see an eye doctor or the dentist. It's always been, we had to travel.
Where did you grow up? Tell me a little bit about that.
I grew up in a small community in Lincoln County called San Patricio. It's in between Ruidoso and Roswell, basically.
Must be beautiful.
Oh, it's beautiful.
Beautiful.
Yeah, beautiful valley. Yes, it is.
I think a place where medical professionals would like to live. But there's not the population to support that.
It's grown. It's grown quite a bit since I've
So it was just
left.
common for you, common for people in rural New Mexico to travel.
It was.
Absolutely, and
It still is. Now they have a school-based health center on the property of the school where I attended, which we didn't have back then. So if there was ever an emergency, my mom can go to that facility versus driving 28, 30
That's
miles.
something new, kind of, I mean, relatively new in the past 30 years.
Yeah.
Jerry?
You know what, I look at a big change that happened with COVID. And ordinarily, at this time of the year, organizations would be asking us to find about 300 people.
300 medical professionals.
Correct. And what did you tell me yesterday?
Just
That we had-
yesterday, I'm updating our vacancies on a daily basis. Yesterday, I was at 823 total. not just physicians, this includes all health professionals. And we don't claim to know all the vacancies. These are just with organizations that let us know.
Yeah, we don't measure need in the sense that what does New Mexico need? We measure what organizations are asking us to find.
And as a nonprofit doing this, at one point you say, yay, that gives us a lot of business. Jerry, right?
It gives us an enormous amount of business. Our funding is fairly restricted, but we have the luxury of having a good board of directors that allows us to say, hey, Diane, if you need to find someone to work for you, go ahead, Jerry and Melissa and others to do that. We're specifically funded by the Department of Health to recruit for something called the Rural Primary Health Care Act, which is basically not-for-profit community health organizations and for the critical access hospitals and those organizations that hire National Health Service Corps obligated health professionals.
So, of course, and I'm kind of joking aside here, but rural New Mexico, of course, needs physicians, but it keeps you, quote unquote, in business as a nonprofit if you have 829 slots to fill compared to 0.
It makes for busy days, let's put it that way. Very busy days. And finding health professionals is what we do. And nationally, there's not a shortage of people looking for work. One of the problems that we run into is that
there's not a shortage of medical professionals looking for medical positions. There's not. I mean, there's a lot of people out there.
There are a lot of people
with qualifications and
we have to. New Mexico has to compete with them, with those other states that might pay more money, give better benefits. What we're seeing since COVID is that health professionals have developed really precise demands in terms of the medical record that is used in an organization. How many days off do I get? Can I have a life outside of practice? All those things play a role. We oftentimes look at the ability of the state to fill all of these positions through our educational resources. That can't happen because there are too many openings than what our educational system can produce.
You're saying UNM and New Mexico State that you're telling them, or they know that we need to produce more physicians.
They absolutely know. They absolutely know. They don't have the resources to be able to do it. And if you look at a shortage of practicing folks, what is the shortage of faculty members to be able to train?
Oh, come on.
It's
now you're
just
making
as
it
severe.
More difficult. Come on, Jerry, you told me this was simple. Or you told me it was not simple. I think it was not simple.
Right.
Oh, so it's the faculty we need.
It's the faculty.
But I guess the good news is, I mean, we have medical professionals across the country. I mean, we're not lacking people with the qualifications across the country. They're out there.
The big shortage relates to physicians. And again, it's not one of those simple things. Back in the 1990s, Congress passed something called the Balanced Budget Act. And it capped the number of physicians that could be trained at the residency level. And there was a projection by an academic institution that by the year 2000, there would be too many physicians in the country. And so they capped the number of resident trained physicians, which are paid, by the way, by Medicare. And so that created an artificial shortage, and now we're trying to catch up. We have 30 years of catch up to do on the physician side of things.
Because they capped it erroneously, thinking
Correct.
And why didn't we want too many physicians? Because of their salaries, if they're awash in physicians, demand, supply?
It was based upon the federal budget and what Congress was willing to spend on physician education.
How has, in the past 30 years, nurses, you were a nurse,
No, I'm not. No, I'm not.
but you had worked with nurses and you know what the demands, and the little I know about them is that they would work 10 hours, 12-hour shifts around, and now they're saying, no, I want Monday through Friday, 9 to 6. What's going on?
Absolutely, but
What are they
still-
saying?
There are still many that work 12, even longer shifts. But they're still out there. Mm-hmm.
No, but when
But
they're
the-
coming, you're trying to recruit them. Jerry was saying, oh, they have their specific things that they want to have a life now. So tell me,
And
tell me,
it's
Melissa,
more
a little
on
bit
the-
about that.
On the resident side that we find that they have many more demands. Absolutely. They want part-time, they want right out of school, or right out of residency, they want a 3-month vacation, maybe. You know, they want to do missionary work. It's not, I need a job, okay, you're going to go work 80 hours, 40 hours, 8 to 5. Am I going to be on call? I need this amount of money. That all of those have changed since the 30 years that we've been
They've
in
gotten
business.
smart, I guess. They know, I mean, right?
They know the demand is out there.
Yeah. Nurses don't need organizations like us, like our organization. They can find work wherever and whenever they want. And that's gone on for a long, long time, maybe going back 15 years or so. We were actually founded as a nurse recruitment organization because someone died down in near Lordsburg, and he was on his roof and had a cardiac event, and there were no local services available. And some people got together and said, hey, we need an organization that will recruit for everyone. And that's how we got started. A bunch of people became motivated to try to find nursing help, number one. But over the years, the profession has changed. How nurses find jobs. It really is much easier for them. They don't really need to say contact us, which was the past, where a lot of nurses would contact us and say, where can I go to work in New Mexico? Oh, it just doesn't happen that way anymore.
So you're not really placing nurses at this point?
Not a lot,
Not a lot.
as we did in the past. Mostly the higher educated folks, physicians, dentists, nurse practitioners, PAs.
Are we beginning a dental school here in New Mexico?
There is one starting here in Albuquerque. Yes.
When?
I think that they open up in June or July. It's Touro University. It's based in New York City or Westchester, New York, and they're going to be sending students here to finish their last 2 years of clinical training.
That's good news. I thought is that not?
I don't know.
I thought was UNM trying to start a dental school?
UNM has a dental residency. It's a 1-year residency, and then some of the residents can do a second year of a hospital rotation. I think that there are 6 of the residents who are graduating this spring who are remaining in New Mexico. It's been a great thing. We don't have a dental school, and what the state does is support, I think there are about 14 dental students that go to other states, and we support them with about $30,000 of tuition support each year.
But then they're supposed to come back.
They have to come.
And 95% of them do.
Do come back, great.
Yes.
If you're telling people that you visit, what you do, tell our audience. Give me not a day in the life of Melissa, but tell me what's going on. What we said, now we know not really nurses that you're trying to locate in place.
It's primarily, are you asking which disciplines we're looking for, I would say it's primarily physicians and dentists. We do, recently it seems like we've had an increase in the ask for dental assistants. And I know Jerry handles a lot of the behavioral health and dental in our office, and those are also hard to find nowadays, are the dental assistants. And that's been an increase in our demand.
They can earn more money at McDonald's.
No way.
Correct.
My favorite is dental assistants, getting my teeth cleaned. Used to do it on my birthday and then my son's birthday every 6 months.
Yeah.
People would say, what are you doing for your birthday? I'm getting my teeth cleaned.
Yeah. We've seen a huge increase in the number of master's level behavioral health providers, particularly in the last 4 to 5 years than what we had previously.
You're finding what you're...
We're finding that employers are finding it harder to recruit substance abuse counselors, mental health counselors. Psychiatrists have virtually disappeared.
Behavioral health therapists.
Behavioral health therapists of a variety of sorts are in tremendous demand.
Are we speaking mainly of rural New Mexico, Jerry?
No,
Throughout the whole...
in fact, we focused a little bit earlier on rural New Mexico. What we see in terms of rural New Mexico applies to Albuquerque, it applies to Santa Fe, it applies to Las Cruces, Farmington, Roswell, where it used to be that the more desperate request came from rural New Mexico. Now it's everywhere.
They're requesting it of you to find, what are they telling the state, or what are you telling the state? Because I think what I looked online, that you also kind of let the state know what's going on. The state of New Mexico, the legislature, the governor. Tell me about that role.
I've spent too much time in the roundhouse in the last 30 years. I've had the occasion to draft legislation and help legislators get bills passed. I've had a lot of bills that went nowhere, which happens frequently in the legislature, and have developed relationships with legislators over the years. There's a big change going on in the legislature right now with a lot of the former champions of healthcare have aged out. They've
Just
decided,
like our physicians.
just decided not to run and those kinds of things. So we have a lot of education to do with our legislators.
We're going to do another program with you. We're touching upon what New Mexico Health Resources does, the demand and need. On our next show, Melissa, we're going to be talking about the obstacles, challenges, and why this is happening. Why. This show, we're finding out what's going on. The next show is why it's going on. What the few minutes we have remaining, Melissa, what would you like to tell the audience about what's going on? I mean, you told me you've been in there 30 years. It's been around since 1981. We have 329 positions that you know of that are in demand.
800.
800.
823.
There should be maybe 300, but 800.
It's a little frustrating. It kind of saddens me. I've been doing this for 30 years, and people like yourself might be thinking, well, why isn't it fixed? And it seems like the numbers are just going up. We can fill a position one day, and the next day 3 more are created for a variety of reasons. Just life happens. Somebody dies, or they don't decide they're moving. Somebody, they want to start a family and move on. They want to be closer to their family. So there's a variety of reasons that those numbers do not go down. And it is a little bit challenging. I remember when Jerry hired me.
A little bit?
Yeah, it's hard, because folks are like, why is it still? Why can't you fill those positions? Some positions have been open for many, many years. Some we fill, and then then they open up again. But I do remember years ago, Jerry told me when I first started, he said, don't get frustrated. I go to a lot of conferences. I do a lot of job fairs. He said, don't get frustrated, because you're not going to come home with 5 resumes in your back pocket. He said it takes a lot, and so he's always encouraged me to stay positive. But it does sadden me that it doesn't, that number continues to rise.
And of course, New Mexicans are saddened by it.
Absolutely.
I mean, you're
They
helping.
want a
You're not
fixer.
They want to fix.
They want a
Jerry, in
fix.
the last minute we have, what would you like to share about the trends you've seen and where we're going in the future with medical professionals in New Mexico?
I'm always hopeful. I see a lot of efforts being made to, in particular, address our needs for primary care providers. I think we're going to see more of a switch to, the saying is, everyone practicing at the top of their scope of practice act. And so we're going to see more nurse practitioners and PAs providing direct service that used to be provided by physicians. And those physicians doing more management of teams. I see that down the road.
Wow. Great. So if you're a medical professional, you come to New Mexico, you're going to be happy to operate at the top of your career. No laxing off, right? No, thanks for that, Jerry. That'll get them to come. Hopefully they won't see the show. Okay, you come here, you're going to be working at the top. Of course, those who are motivated would love to do that. Jerry, thank you so much. Jerry Harrison, the Executive Director of New Mexico Health Resources, and Melissa, thank you so much for being part of it. Melissa Candelaria. I'm Diane. We'll be back with another portion with these folks to find out why this is happening. We'll be back next time. Bye-bye.
Issues and Answers with your host Diane Kinderwater is presented as a public service to inform, educate, and better the lives of New Mexicans. To comment on today's program, email us at info@kchftv.org or call us at 505-345-1991. Join us again for Issues and Answers with Diane Kinderwater.